Hello, everyone. I'm Mandana Khalili, Professor of Medicine and Director of the UCSF Research Coordinating Center's Investigator Development Unit of the NIMHD Health Equity Action Network. I'd like to welcome you to our monthly training webinar. Before we start, we would like to acknowledge the Ramaytush Ulani people who are the traditional custodians of this land. We pay our respects to the Ramaytush Ulani elders, past, present, and future, who call this place the land that UCSF sits upon their home. We're proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ulani community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. Well, today we are honored to have Dr. Valerie Yerger speak to us on menthol and flavored tobacco bans, the intersectionality of research, community engagement, and collaboration. Dr. Yerger is a professor in health policy at the University of California, San Francisco. For the past 20 years, her research and advocacy work have focused on framing the disproportionate burden of tobacco among marginalized communities as a social injustice and informing public health policies to effectively reach and engage these communities. She's made significant contributions to understanding factors that contribute to tobacco use among disadvantaged groups. She brings a novel focus on the demand side of the tobacco epidemic that frames the social and political determinants of health as underlying barriers to tobacco prevention and smoking cessation. She's a founding member of the African American Tobacco Control Leadership Council, which spearheads the national movement to ban the sale of menthol cigarettes and other flavored tobacco products. She's a recipient of numerous awards for her leadership in tobacco control, community engagement, policy, and also training. These include UCSF Chancellor Award for Public Service, the State of California Tobacco Control Programs Carol M. Russell Award for Leadership and Vision in Tobacco Control, the Public Health Law Center's Game Changer Award, the Truth Initiative's Sybil J. Jacobs Outstanding Use of Tobacco Industry Documents, and most recently and importantly, the Claire Brandis Community Engagement Award at UCSF. Dr. Yerger, welcome, and we look forward to your presentation.
Great. Thank you. I so appreciate the opportunity to speak on this topic, especially here in my home institution, UC San Francisco. So I am going to just jump into it. I have quite a bit of information to share, and we'll have time at the end for any Q&A. I've given permission to Madonna to sort of gauge if there are any burning questions as I'm presenting. So if you absolutely have to ask, I'm open to that as well. Let me just get my screen up. There. I imagine people can see this, right? Okay. So I came up with this topic based on the information that was provided to me as to who I'd be speaking to. And this is actually what I do, but I haven't really combined all this information into a presentation before. So this was really a nice exercise for me to do. There's not a heck of a lot more that I want to say about myself other than I'm adjunct professor. And I put that out there, especially for individuals who might be early career here at UCSF and you're trying to find your way. I'm trained as a naturopathic doctor. I was California's first non-nurse midwife to be licensed in the state. I had a vision of building a private practice, ran into finding myself a single parent of 4 kids. With my ex at the time, we weren't really talking about mental health. I recognize now some of the issues that he was dealing with, but 20-something years ago, when you have young kids, you got to get a job. And that's what I did. And that's how I ended up at UC San Francisco. I was taken in by the School of Nursing, offered an appointment at some point as an adjunct professor. You have to get your own money. We don't, have a salary check that comes unless we're bringing funds. And I bring this up for those of you who might be in a similar situation and wondering your career path, how important it is to identify what it is that you have a passion about and let that passion fuel you. Pretty much in the same way that we hear, do the work and the money will follow. Well, do the work and the money will follow. I have never had to fall below 100% effort since coming on board in 2001. And I currently have funding from the state of California. I'm renewing a contract that I've had and have been fortunate just in the work in the last 10 years that has brought in multiple millions of dollars. So it is possible. So having said that, proudly say that I am adjunct professor. How many of you have seen the news today? Yesterday was kind of a big deal for those of us working on these menthol flavor bans. This is what I'm going to be talking about, and I'm going to use the first part of this presentation to really talk about how we got to a point where we are, and I'll tell you who the we's are, where we have introduced our second lawsuit against the federal government regarding menthol cigarettes. And it has been a journey. I will share that with you because there's no way in heck I could have done this without having colleagues who were similarly passionate about the topic and were in it for the long haul. And then to talk about our partnerships with community groups and other advocates and how our partnerships led to collaborations that then is really informing the policies that we're working on. So I am talking about menthol, and I will present it to you as I always do in my work, that menthol cigarettes represents an example of social injustice, and it's not intuitive that way, but when you have the information and you provide the information, others understand why you consider it a social injustice. And it takes time to gather the information, to do the research, to be able to present it in such a way that people who are who have absolutely no experience doing any advocacy work, any research, that they understand it. So your information has to be user-friendly, it has to be relevant, and it has to be something that makes sense to them. So the process that I will take you through here, I think only part of my slides are showing. Is that, let me just take a moment.
It's perfect now.
Yeah.
Yeah, sorry. That shouldn't, it needs to be okay otherwise. Okay. So I am going to show you the pathway of my work, starting with taking my research to the community and finding out that I wasn't the only one that was really upset over what I was finding from my research, and finding out that community reactions would lead me to those who were activists and advocates within the community, and building relationships with them over the years, and being able to form partnerships sometimes with people who are much more influential than I am in terms of getting local policymakers to take on an issue, and then how we have gone from doing work at the local level to the state level and the federal level. So the research actually starts for me back in, I guess I got to UCSF in 1998, but I didn't really start working on tobacco until 2000. And this Surgeon General's report that came out in 1998 was relatively new, but it was one that captured my attention, and others that I began working with were also recognizing that within certain racial and ethnic groups, we had a huge problem in terms of tobacco. When the 1964 Surgeon General's report came out, it was a wake-up call. Unfortunately, not all ethnic and racial groups quit smoking at the same rate. And so as the tobacco industry was becoming aware that there were a lot of educated, affluent people who were no longer smoking, the targeting of marginalized groups became one of their main tactics. When you go out into the community and you talk about tobacco, you got to make it real for folks. If you are paying attention to the news, you might think that homicides, police brutality is the #1 issue affecting the Black community, for example. It is a very important issue for sure, but in terms of the actual causes of death among African Americans, you can see here compared to the number of individuals who have died at the hands of either somebody in their community or a police officer or other type of violence. You add that with the number who have died from AIDS, who have died from accidents, and you can even throw in there suicide and non-tobacco related cancers. It does not add up to the number of deaths caused by tobacco. So this is like one of the first things that I make sure that gets known because it's not intuitive. And in many circles, when you're working within the African American community in particular, you have folks who are very well educated and they're not smoking and they haven't seen smoking in their families and they don't know that smoking is as big an issue. But these are individuals who are in a position of power and influence, so you still have to bring it home to them. When I came to UC San Francisco, I was fortunate enough to work on a project where it was an NIH funded project looking at the tobacco industry documents. Nobody was looking at UCSF. Nobody was looking at the targeting of any marginalized group. And so there was a niche there for me. And I was looking particularly at the tobacco industry's influence and their presence in African American communities. And I'm just going to share just very briefly some of the documents that just really caught my attention. And I was just paying even more and more focus on trying to understand why it is that people like my mother, my grandmother, and eventually my brother have all died from tobacco-related diseases. But you see this sort of thing within the tobacco industry of how they thought differently of African Americans in particular, and to draw their intergenerational trauma and relationship to slavery as making them different from others here in the United States. And that as a people, we were much more concerned with being perceived as being having more than what we actually had, and just wanting to sort of not reflect how powerless we might actually feel, and how the industry really wanted to utilize that. And it's not like the industry just figured this out. They went into the Black communities. They did focus groups. They hired firms to study them in terms of their consumer behaviors. And they hired individuals, put them in managerial positions so that they would have direct access to the Black community. So we know that the industry felt that we were different, that we had these aspirational desires based on our connection, in this case, in America, to the slavery, and that somehow affected our community. This might be a document that you have heard, or at least a quote from it. It is a very powerful one to share when you're talking to individuals in the community about the tobacco industry. And in this quote, which was actually provided during a testimony by David Gorlitz, who was a former model for Winston cigarettes. And he said, of course, children aren't the only targets of the tobacco industry. Once, when I asked an R.J. Reynolds executive why he and his colleagues didn't smoke, he responded point blank that we don't smoke this, we just sell it. We reserve that right for the young, the poor, the Black, and the stupid. as I started digging more into the documents, I started to see that there was this emerging company called Lorillard. Well, I had never heard of Lorillard, but I definitely had heard of Newport cigarettes. Well, Lorillard was the original producer, manufacturer of Newports. And in this document that was dated back in 1987, nobody knew about Lorillard. Newports weren't really that popular. The popular menthol cigarettes were Kool in Salem. Kool cigarettes were being consumed primarily by older Black males. Salem was a product that was the choice for older Black women who smoked. But here, Lorillard saw an opportunity to create a product that would be desirable to younger smokers. And so in this, and most of these documents I will also share with you were confidential and previously secret. So this document shows Lorillard had the strategy of going to compete against the manufacturers of Salem and Kool and going where those products were popular, which is in the Black community. And so what started to happen in the late 80s and 90s is that you basically had these menthol wars that were going on. Each of the major tobacco companies had their very specific marketing tactics and marketing programs that were geared toward inner city residents. And this, we're talking Black folks here. And again, understanding that as the sales of regular tobacco products were going down because the affluent, educated smoker was decreasing in numbers, the tobacco companies were really targeting their tactics on those groups that they felt would continue smoking. And they were smoking menthol, so let's just really put all of our marketing efforts into this product. And so here's an example of a promotional van, if you will. It did a number of things. It got individuals who were scared, marketing people who were scared, to walk into these neighborhoods that give them something protective so that they could actually penetrate deeply into these neighborhoods. And they would give out free products. And you know that from this particular document that they considered Black folks as being unruly, and also they were considered to be at risk for a product being stolen. So these vans provided protections in that regard as well. So these racialized menthol wars went on, and they were extremely aggressive as they competed against one another. And as I like to present to folks, the most important target for the industry was the young African-American male, because he was perceived as being the trendsetter. And they figured that if they could just get the young male addicted and using their brand, then the rest of society would follow. So all of these documents were really making me upset. But I have to say that this is what really captured my attention. And it was recognizing that as I was looking at specific relationships between the tobacco industry and Black organizations, that it was pervasive. I saw organizations that I was personally involved in that had an affiliation with the industry. I saw organizations that my grandparents were involved with. And this actually pushed me through to tears and having an emotional experience that was noticed by Ruth Malone, for those of you who may know her. And she was the one that said, wait a minute, there's some power in these documents. And it was there that we really started to make this research much more bigger in terms of where we put our focus. So one of the first papers that I produced was called Smoking with the Enemy. It outlined these relationships and why the tobacco industry was investing so much in developing these relationships. The obvious one was to keep African Americans engaged as their consumers. but it was also to utilize these relationships to diffuse tobacco control efforts and to get African American organizations to act as front groups. This paper was published 22 years ago, and it is still relevant. And I spent this time talking about this so that you would have an understanding of why it is we're dealing with those who look like us, but who have ties with the industry that are not disclosed. And their position in society has given them access to the very policymakers that those of us who are trying to do good policy work don't have access to. So that is what's happening here. So with the case of menthol makes tobacco products so much easier to take up. 40% of our high school and middle school students who are smoking start with a menthol cigarette. The rest of the 40% are using some other flavored tobacco product, but menthol helps cigarettes be much more easier to smoke because they mask the irritation of nicotine. They lessen the harshness of the tobacco smoke itself. And because it's so much easier to access the nicotine, menthol cigarettes are much more addictive, and they make smokers who are trying to quit have a harder time quitting. And so our argument has been and continues to be that menthol cigarettes are really responsible for a lot of the health disparities that we're looking at today. If we look at the use of menthol, and this is where the social injustice part starts to kick in, you start to see that back in the 50s, only 5% of African Americans who smoke menthol cigarettes. That increased threefold in like 15 years. And then in less than a year, it increased threefold again. And today we're looking at 85 to even 90% of those who smoke are smoking menthol cigarettes. And just to compare the other groups that are smoking menthol, these numbers might be slightly higher because what we're finding out is that the youth within these racial and ethnic groups are starting with menthol cigarettes, again, because of the popularity of Newports among our youth. I am a founding member, as was pointed out in my intro, with the African American Tobacco Control Leadership Council. We came together in 2008. I was at UC San Francisco, but the individuals that you see here were funded by tobacco control projects within the state of California that no longer were getting funding for whatever reason. I was a part of that fight, but it had to do with this California Tobacco Control Program changing their strategy of how they were going to do tobacco control and make tobacco control policies something that was engaging to the ethnic groups in the state. So they ended up not having their funding, but they still had the fight in them. And so we today are still together. Some of these folks have retired and moved out of the state, but I would say that at least half of the ones who are in this picture, along with others, are still engaged in this fight because it is something that has really made us very passionate about something that we felt that we needed to do for the protection of our community and to save our young people. When it comes to who's out there doing the work, it's myself, Dr. Phil Gardner, who was with the Office of the President. He was actually one of my funders with the tobacco research, tobacco research. It's been so long since I've been funded by them. Don't tell them I'm messing up on the name. But TRDRP, which was through the Office of the President. He has retired, but he's still heavy in the fight. And then Carol Magruder, who's a long time, 30-year tobacco control vet, who is also still funded by the state. And it's been the three of us, and then getting work. By no means are we doing it by ourselves, but we're leading this. So we know that we weren't the only ones concerned about menthol back in The early 2000s, the United States Congress was snooping around in terms of menthol and found that it had some potential health risk, especially for the youth. So in 2009, President Obama signed into legislation the Family Smoking Prevention and Tobacco Control Act. I could do a whole talk on this whole process, but just to give you some background, what happened, even though menthol cigarettes were recognized as being potentially harmful, especially to certain ethnic and racial groups and to the youth, when President Obama signed this act, it gave the FDA the authority to regulate tobacco products. Unfortunately, what happened was that the FDA only banned flavored cigarettes other than menthol. And if you knew anything about these flavored cigarettes, I think they represented 0.03% of the market of flavored cigarettes. But in any event, they were banned. Menthol was given a pass. And one of the reasons why is because the industry was fighting very hard for this product to stay on the market. In 2015, Reynolds American bought Newport from Lorillard for $27 billion. And when Amazon bought Whole Foods for, I think it was $6 billion, it made front page news. And nobody really talked about this. And fewer people talked about how in 2017, Reynolds American sold Newport to British American Tobacco for $49 billion. So this is why we know that menthol has been protected. British American Tobacco is not even a US-based company. So one of the things that the FDA was mandated to do by the act was to at least study menthol and to take a look at it, the science to basically justify any actions taken to remove menthol from the marketplace. And the act also mandated the formation of the Tobacco Product Scientific Advisory Committee. They did their own research. The FDA did their own research. And both of them produced summaries from that research that was very similar, which was, yes, menthol cigarettes are killing a lot of people. They're causing a lot of the kids to start smoking, and they are disproportionately affecting African Americans. That was back in 2011. And they recommended, the Tobacco Product Scientific Advisory Committee recommended that the removal of menthol cigarettes from the marketplace would benefit public health in the United States. Subsequently, there were other studies coming out to show the harms of menthol cigarettes on the African American population. And this study, which was published in 2021 by my colleagues from the University of Michigan, David Mendez and Trey Lee, show, and it was the first time we had the real evidence on the health harm of menthol on the Black community. And it showed that despite the fact that African Americans represented 12% of the total US population, they carried 41% of the premature deaths due to the use of menthol. And if we looked at life years lost, we still see this huge disparity and burden on the African Americans. Again, 12% of the population, but yet bearing 50% of the life years lost due to the use of menthol cigarettes. And that we see that if we look just at the number of African American children who started smoking just between 2009 and 2020 because of the availability of menthol cigarettes, it's 500,000. And it's actually much larger than that if you look at the other children who are smoking cigarettes. We know, and there's research that has been done even as recently as just a couple of months ago, showing that over half of African Americans who smoke are supporting policies that ban menthol cigarettes. So it's like you're asking the question, like, what the freaking A is going on here? Like, I'm just shaking my head. Why is it we're having a hard time getting these products off the market? So that's where the fight starts. And I'm just going to do a check-in with my time. So I've got a few minutes. I want to quickly go through where we are here. Back in 2013, when the FDA had not made a decision about banning menthol cigarettes, the Public Health Law Center, which is out of Minnesota, were very interested in what they could do and how they could help. And you attend conferences with these individuals. And so the conferences, if you have a chance to go to a conference that's on your subject matter, you can do a lot of great networking. Dr. Phil Carroll and I had met members of the Public Health Law Center, these attorneys, and they're like, you know what, we can do a citizen petition. I don't know anything about a citizen petition. I hadn't even heard of a citizen petition, but they did. They wrote out this citizen petition that basically provided all of this peer-reviewed um, um, study results and their analyses showing how important it is to get rid of menthol if you want to save lives. And so this petition, the citizen petition, was to compel the FDA to remove menthol cigarettes from the market. I was invited to sign on to the petition. There were multiple numbers of health groups. I was the only individual that actually signed on to it. And so they asked me to go with them to Washington, D.C. to present it to the FDA. That was back in 2013. We were looking fresh and happy and thinking, oh my gosh, this is really good. But this has been 11 years. So when we're going out into the community, because by now it's been a long time, obviously nothing has happened. We have to be very clear about what we want community members to do. And so we have very specific calls to action. We got to get people informed about the issue. Then we got to give them some sort of options of what they can do in order to participate. If they don't have a bone in the fight, they're not going to fight. So and once they want to fight, you got to give them something to do. So we just came up with a number of different calls to action, depending on whether they are working at the local level or the state level or the federal level, giving them some ideas, presenting some examples, inviting them to come with you or to join you on a webinar. Training is a good way to get folks engaged. So how do we go about identifying and engaging with our community influencers? I am a member of Delta Sigma Theta Sorority Incorporated. It's been around for 113 years and well, 100, almost 100, 111. I'm trying to make my organization older, 111 years. And I recognize the power of this organization that has a membership of over 300,000 predominantly Black women who are college educated. And at our 51st National Convention back in 2013, I presented through my chapter, which is located here in the Berkeley Bay Area, a resolution. And I knew that this resolution would be very powerful for making a statement to my sorority, and that it would be an opportunity to educate them on the issue because nobody was talking about it. And to my surprise, this resolution was adopted. There were almost 40,000 members at this convention in Washington, D.C., and there wasn't a single solitary objection to it. That resolution helped to inspire the NAACP. So in 2016, the NAACP at the national level adopted a resolution. And by the way, I have written that resolution for NAACP as well. Let me go back because sometimes I oversee things. So I just want to make sure that I say that Deltas have not just one, but they have two resolutions. The second resolution was really focused on supporting state and local efforts. That first resolution was directed to the FDA. But after a few years of the FDA not doing anything, I had this idea maybe I should just do another resolution so that individual chapters would have the ability, if they chose to get involved because something was happening locally around this issue, that they could do so. And the resolution would empower them to do that. So that's why we have the two different resolutions. And so the second resolution was very similar to the one that I wrote for the NAACP, which gives their local branches the power to support the efforts. In 2017, the National Medical Association passed and adopted their resolution, very, very similar. And just last year, Alpha Phi Alpha, which is the oldest African-American male, well, all fraternities are male, but Black male fraternity adopted their resolution. And these resolutions are very, very similar, giving their local chapters the ability to support any efforts happening locally. 100 Black men also passed a resolution, and it's my understanding too. I know that the national, at least the San Francisco chapter of the National Black Nurses Association passed a resolution. I have heard that they've done that at the national level. I just have not personally seen it. So when you are trying to engage your advocates, you want to widen your base by widening your message. And what I mean by that is that it's very often the thought that African Americans are the only ones concerned about menthol. Menthol is a Black cigarette. It is true that a larger proportion of Black smokers do smoke menthol cigarettes, but the majority of people smoking menthol are not Black. And so part of the education is to let them know that the work that we're doing is also going to be beneficial to those groups that they are members of or that they're working to advocate on behalf of. That includes the youth, especially LGBTQ youth. It includes the Latinos. It includes Asian Pacific Islanders as well. So large groups. And then women in general smoke menthol over regular cigarettes. So when you are starting your work, you get noticed, you get invited. Yes, we've been to a number of jurisdictions to help them. We do not go into jurisdictions and start things. We get invited. And then, of course, there's like a couple of pockets of places here and there. When we first started, there was only, Chicago was the first. And then we ended up doing some work in Minnesota as well. But when we came to San Francisco, that's when things really took off. And the reason being is that because of the leadership that we had here in San Francisco, Malia Cohen, who at the time was the supervisor, said, let's just do a jurisdiction-wide ban. There's just no restrictions for those retailers that are just selling tobaccos, no creating a buffer zone around schools where within that buffer zone you couldn't sell flavored tobacco. Let's just not sell it throughout the city and county of San Francisco. And that was back in 2017 when we got that law. So just to show that we really engage different types of groups, got them on board to follow with us and to help us out, because to us, it was like a win-win situation. I'm going to go through it. And this is what's really powerful too. When I talk about San Francisco, I show the Black faces who were involved in the work that we did back in started in 2016, 2017 is when we started with the legislation of it. There's a chapter of Deltas in San Francisco. We engaged them. They had a resolution, so they didn't need to get permission from the national president to get engaged. The resolution empowered them to get involved. And the same thing with the NAACP. We had a representative from the San Francisco branch who was also here at UCSF who spoke on behalf of the bands. To get the kids engaged, we held spoken word events and giving them just a little bit of information about the issue and then letting them fly, just letting them create based on their own personal experiences. And one of our biggest advocates had come from one of these spoken word events that we had. And we saw her a lot. The state utilized her a lot as well in some of their campaigns. And here she is. This is a 6-footer who was one of our winners for one of our contests, speaking out on behalf of the menthol ban. She lost her mother 2 years ago from tobacco. We had no idea, she had no idea that she was going to be so compassionate about this topic. So just want to show within just a few months of San Francisco passing the very first comprehensive flavor ban in the country, 84 localities in California followed. And that was back in 2018. There's right now, I don't know what the number is. I didn't look at it, but it's hundreds. So it grew very, very quickly. Let me I just have a couple of more minutes, but I want to talk about our lawsuit very quickly. The AATCLC, along with co-plaintiff Action on Smoking and Health, we filed a lawsuit against the FDA because by 2020, there was still no action on menthol. Several months later, the American Medical Association asked if they could join us as a co-plaintiff. And then in December of 2020, the National Medical Association asked if they could join. And this lawsuit prompted the FDA to get up off their rumps and to propose a final rule banning menthol cigarettes. And they were committed to doing so. Their process is to propose the final rule. And there's a whole long process that involves getting public comment and months and months and months of going through those public comments and knowing that the tobacco industry will send in hundreds of thousands of comments, which they have done in the past. Javier Becerra, our former state attorney general, who's now the Secretary of Health and Human Services, was in favor of it. And he's been very supportive of this ban. Unfortunately, the ban, the proposed rule has ended up in the White House, and that's where it has been. We have been getting promises from the White House that they were going to make a decision. First, we were told that we'd be notified of a decision by August of last year. Then they extended it to December of last year. And then in December, they said, well, we'll know by March. And we just held on and held on. And the NAACP and others were coming out talking about the need for the White House to go ahead and approve the finalized rule. Let's just ban menthol. There have been attempts from other organizations involved. They've been spending money for ads showing the numbers of groups that are supporting this ban. And so yesterday, what we did was we filed another lawsuit. And this time, three of the co-plaintiffs are still involved. And this difference with this second lawsuit, again, is to really tell the FDA, you guys don't need the White House approval. You guys can just go ahead and just, approve the proposed rule. But politics being what they are, the tobacco industry being involved like they are, we're finding out that it's not going to be as easy as that. So I'm not going to say any more about it. If you go into the news, there's a lot of news about it. The tobacco industry is very, very busy, and they're utilizing a number of their old cronies out of the Black community who have access to Biden's ear. I can't get a meeting with Biden. We've been invited to speak to his staff, but we don't have access to him. And so we keep doing this work until something breaks. But in the meantime, we will continue focusing on our local efforts. And tobacco control has been as successful in protecting people from tobacco by working at the local level. So we're not going to give up on that. And that's where the community engagement and collaboration and all of that is very, very important. I will end this by saying that California is moving towards the end game, which means that we're getting rid of all tobacco products. We're getting rid of the tobacco industry influence. We have the resources. We have the political will. This is where we're moving. But it's going to take time because not all groups are ready for the end game. So over the next, I don't know how many years we're going to do, we're going to make sure that we continue our educational and advocacy efforts and engaging and collaborating with communities so that all groups can benefit equitably by getting rid of all tobacco products. So I will say thank you here, and hopefully I didn't go over too much of my time. And you can reach my organization, SavingBlackLives.org is my organization through is the AATCLC, and I'm affiliated with them, and a lot of the work that I'm doing is through them. But I also have a website that is reflective of the work that I'm doing for the state of California's tobacco control program. And I didn't put that up here, but that's the Loop, the Loop, LOOP.UCSF.edu. So I am going to stop this and reconnect with everyone here.
Dr. Yerger, thank you so much for that outstanding presentation. And I have to say, I wanted to really thank you as well for sharing your journey, both personal and professional. I know that it was very much appreciated, and hopefully it be lessons learned would pave the path to career advancements for others. And the policy aspect of things were incredibly powerful. Really appreciate you sharing those, again, lessons learned and ways to widen advocacy through community engagement. We do have a question here from Dr. Danish. If you don't mind asking it, since it's a small group here in person, that would be great. Go ahead, Dr. Danish.
Hello, thanks a lot for the great presentation. My question is about the hookah, water pipe. Do you have any idea about the rate of using it? Because most of them are, the tobacco is using is basically is flavored. And, as far as I know, each head is equal to smoking 20 cigarettes. And I would be, glad to have your, information on that. Thank you.
You're welcome. So when we started our work on menthol products, we didn't even have e-cigarettes that we were dealing with. And so the rise of hookah outside of whatever cultural uses, which we've been told are non-existent for the majority of those who are actually using it. Hookah is being used by youth, especially African-American youth. It's become a source of business for young folks. The problem is advocating for the need to get it out of the market as well. It was an unfortunate thing when the governor signed SB 793, which was our statewide ban. The tobacco industry was really fighting hard to keep hookah and from being part of that legislation. And it's difficult to argue for something if you're not part of a group that they say this is their product. That's why with menthol cigarettes, it's like, that's a Black thing. You're not going to go in and tell Black people they can't smoke their cigarette. Well, we saw the same tactics being used by the industry in terms of hookah. I would say there needs to be a start. We need to identify those who have the research, who can do the research and make it show that there are harms related to the use of these products, to be able to show that those who are advocating that these products stay on the market have some sort of ties to the tobacco industry, pretty much in the same way that we've done with menthol. And I see Mignon is on, and I know that she probably has something. Oh, there's your hand. I just knew that you wanted to say something. So I would love for you to chime in, but it is definitely an issue. We are aware of it. We need help. If we're going to get out and do that, we need more people involved.
Yeah. So so thank you, Val, not just for your presentation that I came in late, but I'll go back and watch a recording, but thank you for finally submitting the second lawsuit, because I was watching March 28th pass, March 29th pass, and I was waiting to see what you guys would do next. So thank you so much for continuing your hard work on that. Just to answer the question about hookah, Tom Eisenberg has done a ton of research on hookah and water pipe very early on in the dangerous. I think that Dennis Trinidad in California has some data, and you could probably contact someone at TRDRP, because they have a lot of data on hookah use in California specifically. If you're actually, I don't know where you're located. If you're in California, then you can do TRDRP, and you can do who did I just say? Dennis Trinidad, and they should have some data for you on hookah. I forgot, but the hookah use is, as Val said, it's the prevalence in Black communities is like off the hook. It's like skyrocketed, and particularly they have hookah brunches, and in Atlanta and everything else. It has really infiltrated our communities. But something else I wanted to quickly, I'm going to send it to you, Val, but something else I wanted to quickly just throw on this call. I'm part of a group, and I think at the Truth Initiative, that is watching the tobacco industry. So there's individuals that are tobacco industry watchers, and then there are the scientists, and then there are the doers. Val kind of, you're all in all three of those spaces. But someone just sent something to me that we may want to be mindful of, which is how Philip Morris is actually now creating continuing medical education courses for Clint. Girl, did you see it?
No, they're at Hayward. They're at Hayward State. Or at East Bay. They call it East Bay.
I'm sorry. We just went as if no one else was on the call. I'm sorry. So I just got an email, and what they're doing is really quite terrifying, which is they're providing continuing medical education classes for clinicians. And the way that this education scaffolds, it goes right into moving people off of combustible cigarettes into e-cigarettes, i.e. their fake harm reduction. And in an effort to try to get the clinicians in the United States to buy what the clinicians at the NHS in England bought, but now are rolling back on. But that's what's happening right now as we speak in our country. And it is terrifying. It is terrifying because public health researchers who conduct tobacco research, which I am one of them, too many high profile scholars have pivoted and moved into this harm reduction state, which is really just the tobacco industry's propaganda and their off ramp for combustible cigarettes. And one more thing I'm going to say really quickly, which is, the problem with the menthol ban is all where it is. But while everyone has menthol ban on lockdown, pay attention to the fact that the FDA is excluding menthol vapes from that ban. And that means that, so if they're excluding menthol vapes from that ban, and industry's telling clinicians, oh, get people to go smoke, to use vapes, we got to get ahead of the game. That's going to be the next problem in Black community, Black, brown, LGBTQ plus, and low-income white communities. That's our next health equity issue. Like, it's right there in our face, along with that crazy menthol thing that they tried to put on the market. And now I'm going to stop talking because this is not my talk. But I was going to text you, and I realized you were on the talk, because I was like, Val, they're doing continuing education credits right now, or continuing medical education, and it's terrifying. They're educating our clinicians about their products. It's probably not going to save lives.
Thank you, Dr.
It just saved them their profits. It's all about money.
Yeah, their end game and our end game are two separate games.
Indeed.
Thank you.
My goodness. Any other questions from the audience? I just have one quick question for you, Dr. Yerger. I was wondering what has been the impact of the pandemic on the use of these products, and do we have some information around that? Because obviously the substance use was picked up quite a bit during that time frame.
Well, it revealed just how massively sick a lot of us already were. So, you know, having the pandemic, you looked at who was in the proportion of people who were dying, who tend to be smokers. You know, smoking put us at risk for having adverse reactions to being exposed to COVID. But just the whole stress overload that happened, and people being driven to start using substances, to increase their use of substances due to their stress overload has been massive. And folks have not recovered. So, you know, most of the talks that I'm doing now, people want to know more about, well, tell us about how smoking deals with stress and how do we handle the stress. And I actually was invited to the White House last June, along with my co-chairs, Carol and Dr. Phil, to the Cancer Moonshot Forum on Cessation. And there were about 80 of us who were there. All the heads of the major health departments were there. The federal agencies were there. And only one person who spoke to us mentioned the word stress. And that was the head of the VA. And he talked about stress in terms of PTSD. And then we were broken up into smaller groups, and there were about 30, 35 people in my group. And again, nobody talked about stress. I brought it up. And as a result of that, people were like, we got to talk about it more. So I have been engaged with the White House over what we could do to help smokers address their stress. And we have partnered, or I have partnered with the UCSF Smoking Cessation Leadership Center, with the Center for Tobacco Control Research and Education, with the emotional brain training folks, where their researchers are out of UCSF as well. They also have a free app. So I helped to create a guide for the use of that free app. And we are currently disseminating it as a way of helping people to at least deal with their added stress in the moment. And the ideal situation would be they pick up the app instead of a cigarette.
Well, thank you very much for all, again, the efforts that you are doing. And we're very grateful and really, really appreciated your education on this topic. Thank you.
All right. Thanks for inviting me.
Thank you. Bye-bye.
Bye-bye.